Hello, I'm Jonathan Van Bilsen, and welcome to the Medical Associates of Port Perry Vaccine Update, presented by the Scugog Chamber of Commerce. Today's show is live, but it will be available on Rogers TV and the Chamber's website, as well as their YouTube channel. I would ask you all to not unmute yourself and please turn your cameras off, as it makes it much easier for us to navigate through the technology. Because many of you have submitted questions for our panel, we'll be turning the chat feature off, and I'll pose the questions to our guests directly. Before we begin, I want to make special mention of the sponsors for today's event: Mike Adam of Gus Brown Pontiac Buick GMC Limited, PP Print and Digital Services, Scugog Computers, and Voss, your independent grocer. Before we start, I want to ask Terry Voss, Vice Chair of the Chamber of Commerce, to say a few words. Terry? I think your microphone is off.
I'd also like to thank our sponsors today that made this meeting possible: Mike Adams from Gus Brown, Scugog's Computer, PP Print, and Voss, your independent grocers. Now we hope to enjoy this information that we are sharing today. Thank you once again for joining us today, and enjoy.
Thanks, Terry. Vaccines are in the forefront of everybody's mind these days, and with them come a number of questions. Today, we're going to hear from our guests: Stephen Gray, the CEO of Medical Associates of Port Perry, Dr. Dan Riccuito, Medical Director for Infection Prevention at Lakeridge Health, and Dr. Rebecca Wray, who is the lead physician for inpatient care at Lakeridge Health in Port Perry. I'll ask each of our guests to give us an update in their respective fields, and then we'll ask any questions of them that were not covered in the presentation. Our first guest today is Stephen Gray, CEO of Medical Associates of Port Perry and the North Durham Family Health Team, as well as chair of the new Oak Ridge Hospice. Stephen is also co-chair of the Durham Region COVID-19 Response Table, as well as a member of the Ontario Health COVID-19 Response Table for the East Region. Stephen is going to explain the current state of the pandemic, as well as discuss the vaccine rollout for our area. Stephen, welcome to the show.
Great. Thank you, Jonathan. It's a pleasure to be here. I'm going to share my screen. Is that working?
Perfect.
Okay. I'd like to start maybe with giving everybody a bit of a window into what's happening at North Durham Health Center, which of course is home to Medical Associates and the North Durham Family Health Team. We are conducting about 70% of our patient visits through virtual means. So many of you may have experienced that through either a phone or video visit with your provider. Some of our team members here at the clinic are continuing to work from home, some of our admin staff, and in fact, our providers are in many cases delivering virtual care remotely. And of course, that's all in the interest of minimizing the activity in the building for everybody's safety. And with safety in mind, we obviously are continuing to deploy our public health protocols. So for those of you who've been to the clinic, you will have passed through our screening process. Masks, of course, are mandatory at the clinic. And something you may not know is we adopted an electronic screening app that's available on our website, and that's listed on this slide. You can click on the screening tab. It takes you through the questions electronically on your device. At the end of the screening, it'll display a graphic, which is a pass, and you can show that to the screener as you enter the building. And it's just a more efficient and effective way of screening for everybody. The other thing I want to mention is that we're encouraging our patients to provide their emails. Of course, this in the interest of communicating as effectively and as timely as possible, particularly in this environment we live in at the moment. Communication is key. So once again, you can go onto our website. You can click on register email. You can do that online. We'll update your profile, and then you'll be part of the emails we send out. We don't send out a lot of emails, but those that we do are full of information that I think is important for you. Let me just give you a quick update on where COVID is in terms of Durham. So I want to draw your attention to the durham.ca website. This is a website that's put together by our public health partners. There's a COVID tracker on this site, and if you haven't seen it, it's probably worth your while having a look. There's a lot of data on COVID activity. But there's also now good data on vaccine. There are a Q&A section, frequently asked questions, lots of robust data there. And then there's actually a new tab that's recently been added for vaccine itself. So you can look at the vaccine numbers and they're updated daily. So you can see how many people in Durham are vaccinated. So if you haven't visited this site, I would suggest that you take a look at it. So in Durham, and across the province, we have been experiencing a steady decline in cases. Of course, this started to turn relatively recently, and we're now on the rise again. The good news is that in long-term care and retirement homes, we've seen a steady decline in activity. And of course, this is a testament to the vaccine. The variants of concern that we hear so much about, those rates are now around 60% of the cases in Durham. And as we all know, Durham remains in the red zone. And I've just thrown a couple of indicators up. These are just a few of many, but probably ones that you've heard about or you've seen before. And these are some of the indicators that go into determining what restrictive zone a region might find itself in. These are available on that durham.ca website. I wanted to also draw your attention to the COVID assessment centers. So there are a number of assessment centers across the region. Ours here in Port Perry is just up the road at Prince Albert. You can get an appointment at assessment centers in under 24 hours. In fact, in many cases, you'll be able to get one the same day. Swab turnaround times or result turnaround times are running around 2 days in the province, so fairly quick. We encourage anyone who experiences symptoms to book an appointment as soon as that happens. Don't wait. The process to receive your results is fast. And so we encourage you to book an appointment as soon as you experience symptoms. Those two websites that are posted at the bottom are full of information. The northdurhamcovid.com site provides the hours, and both have the booking link to make a booking online. So the vaccine, so you're probably very familiar with the 4 vaccines that have been approved in Canada, Pfizer, Moderna, AstraZeneca, and Johnson & Johnson. Durham now has both Pfizer and Moderna, but for quite some time it was only Pfizer, and that posed some challenges for how we deployed the vaccine strategy, because there are some challenges around, as you are aware, I'm sure, challenges around both the storage and transport of Pfizer. But Durham now has recently started to receive Moderna, so we'll see a little bit of an expansion of our vaccine deployment as a result of that. I wanted to share this slide with you. You may have seen it. It's a little busy. It's the provincial plan for the vaccine distribution, and you've heard of the phases. There are 3 of them. Those are listed in the 3 columns. We have gone through phase 1 are now entering into phase 2. Phase 1 included retirement homes and long-term care settings, healthcare workers, our First Nations community members, and those over 80. And now we're starting to move to phase 2, and most recently, you'll be aware that those over 75 can now be vaccinated. The 3 horizontal bars at the bottom, the blue, green, and yellow, those are really mechanisms for the distribution of the vaccine. So the first blue bar there is the hospital site, which has now moved to Ontario Tech, and the mass vaccine clinics run by Public Health that are now active. The second bar, the green, is the onboarding of primary care and pharmacies, and in some regions that started to happen, not yet in Durham, but it is happening in some other regions through pilot projects. And then the yellow bar is the mobile strategy. So that's to deliver vaccines to those who are unable to attend fixed sites. They may be homebound or in remote settings. And now that we have Moderna in Durham, we're starting to see that strategy be deployed. So the priority populations at present, obviously long-term care and high-risk retirement homes, which are effectively done in Durham. On March the 2nd, we immunized the Mississaugas of Scugog Island First Nation. Our priority healthcare workers, medical first responders, and essential caregivers are vaccinated. And many of our 80 plus, and we've now moved into vaccinating those who are over 75. The final slide I want to show you today is the clinics themselves, where they're located. There are 8 of them across the region. They've all opened at various dates. Let me highlight for you the Scugog, Uxbridge, and Brock centers. Scugog will be at the Scugog Arena. Uxbridge will start next week on the 29th, followed by Scugog on the 31st, and Brock on April 3rd. These 3 sites will rotate. So it'll be one team cycling through those 3 sites. It'll be 2 days in Uxbridge, 2 days in Scugog, and 1 day in Brock. And when all these sites are running across the region, we'll be able to deliver about 10,000 vaccinations a day. Now, these will flex up and down depending on supply, and we've all seen in the news how supply is varying. And so as a region, we will be flexing up and down to accommodate that supply with a strategy of ensuring that as fast as the supply comes in, we are vaccinating and putting that in arms. So I'll leave you with the last link, which is durhamvaccinebooking.ca. That's the link you can use to book your vaccination when your turn comes. So Jonathan, I think I'll leave it there and turn it over back to you.
Thank you very much. A lot of information there. Appreciate that very much, Stephen. Our next guest is Dr. Dan Riccuito, the infectious diseases specialist for Lakeridge Health, the medical director for infection prevention and control for Lakeridge Health, and the chief medical director for quality and patient experience, again for Lakeridge Health. He is also a member of the Durham Region COVID-19 response table. Dr. Riccuito, welcome to our show.
Thank you very much, and thanks for having me. Just to confirm, are you able to see the slides that I'm sharing?
Yes.
Okay, thank you. So I'll start off today by giving a little bit of a background as to what the COVID situation is right now, and then get into talking at a higher level about some of the vaccinations, and then I'll pass it off to Dr. Wray to speak a little bit more about some details about each of the vaccines, some common questions that do come up. The slide here is just showing the impact that COVID has had. I do apologize, these are about a week and a half old, but we've had about 125 million cases of COVID documented globally. When you think about it, this is probably just a fraction of the number of actual infections, as we know that most people with COVID have not been tested or diagnosed, especially in some underfunded or under-resourced regions. The number of deaths now have been over 2.75 million, which is astonishing over the course of 1 year. And in Canada, as I mentioned last week, over 875,000 cases. This is higher now with more than 22,000 deaths related to COVID. And if you are diagnosed with COVID, then there's about a 1 in 13 chance of requiring hospitalization here in Canada. And out of those that are hospitalized, about 2 to 3 will die. And so, the significance of it is quite important. Thinking about previous. Earlier on in the pandemic, where people were, wondering whether or not COVID was similar to other viral infections like influenza. Clearly, it's much more severe and lethal. So what's happening right now with respect to COVID? This is the cases in Durham available on that website that Steve had showed you from the Durham region. And you can see that the first wave here, it looks small, but in fact, it was much bigger. We just weren't testing as much back in April and May of 2020. But you can see that we had a significant spike up, peaking in January, which prompted the lockdown provincially, which did work. And, we had a significant decrease in the number of cases during that time, going from about 200 a day in Durham to 30 or 40 a day. And now, unfortunately, you can see over the last week or so, we've had a significant rise in cases again. And I'll show you why this has been happening. The increase in cases does go along with the change from the stopping of the stay-at-home orders, and then the change of the framework in Durham to red or control. So we're still under red and control, and cases are going up. So one important piece of information to look at, in addition to the number of cases overall, because certainly if there's cases and no one's getting sick enough to be admitted to hospital or ICU, then the number of cases or the case count wouldn't be as important. So we want to also look at how sick are people getting, and are they being hospitalized? Are they ending up in the intensive care unit, and are they dying? we did see this large spike up in January again, which corresponded with the number of cases in the community, both in hospitalizations, so that's the light blue bars here, as well as patients in the ICU. And the ICU are both the red and dark red. The dark red are those that are on a ventilator. Things came down nicely, but as you can see, they've started to go back up again, predominantly hospitalizations, but also going up somewhat in the intensive care unit. And we have a fairly high level of patients admitted to the intensive care with COVID as a diagnosis across the province. We don't have a lot of extra room in our intensive care units to hold others. As you can compare towards the summer, the baseline that we're at now is much, much higher. Okay, so one big question that has been circulating and has been in the media, and a lot of talk about it in addition to vaccines, are about the variant strains. And what this means, or what these are viruses that have undergone mutations. So there are coronaviruses that have undergone mutations that have changed the virus to the point where they're behaving differently. So these viruses may be more infectious. They may have a higher risk of severity of illness, or they may not respond to the vaccines the same way. So these are what public health is calling variants of concern. So the three most common ones that are being tracked right now, though there are others that are circulating that we keep hearing about across the world, is the so-called UK variant. This is the B117 strain. This is now making up a large proportion of cases in Ontario. It is about 50% more infectious and associated with about 60% higher mortality. This is out of data from the UK. The other two that they're tracking in Ontario make up only about 5% of all the variants, and about 2.5% of all the cases are the South Africa variant, as well as the Brazil variants, which we'll get into, but they do have some of the same mutations as the UK variant, so they're probably more transmissible. There's one question about these in that the vaccines may not work as well. At least some of the vaccines do not seem to work as well. We're still waiting for data on the others. So that's something to watch out for. And I think the way that things will go over the next couple of months really does depend on the spread of these variants and what's happening. And I'll show you what is actually happening. Unfortunately, the variants are really following this sort of medium profile here at very least with respect to the overall number of cases. Meanwhile, the prior cases seem to be coming down, and I'll just show that in this slide here. So these data are also available. They're from the Ontario Science Table. It's really showing the difference between, it's almost, a tale of two viruses. So on the right-hand side, these blue bars are the early variants, meaning the strains that were circulating before. And this strain caused the spike up in January, but was able to come down with the public health measures in place. And it's kind of currently stabilized, but has and not continued to go down, but it's not going back up as much as on the left side. You can see the variants, which are the predominantly the UK variant, and it's kind of going up and to the right. And there's been a lot of talk about having a relatively large third wave potentially due to the variants, and that's sort of the pattern that we're seeing. We're just kind of early on right now. So with that, what can we do to try and blunt this next wave and really protect ourselves until things do settle down? So there are the usual public health measures in place, which are very important. Stay home when possible, minimize time spent with others, especially out of your household, without a mask on, as these are higher risk areas, and ensuring keeping a distance. The thing that we're here to talk about today is really getting vaccinated, though, and so I'll talk a little bit about that, as the vaccines are highly effective. And I'm showing this slide here. I know you can't read it all, and that's okay, but it really just shows all the vaccine preventable, or many of the vaccine preventable diseases, and really the profound effect that vaccination has had on so many different types of infections that previously caused severe morbidity, made people very sick, caused long-term disability or death, and some of these you can see, and potentially remember when they cause severe problems like measles, polio, of course, rubella and congenital rubella, causing birth defects, smallpox eradicated in the late 1970s, for instance, all major scourges, and all basically cured or ridded by vaccination. And hopefully with COVID, we'll see the same thing. So Steve did touch on this, but there are now 4 vaccines that are approved in Canada. There are 2 that are mRNA vaccines and 2 that are viral vector vaccines. So the 2 mRNA vaccines are the ones that we do have currently available in Durham. They're the Pfizer and Moderna vaccines. And what mRNA vaccines do is they supply your body with the code for creating a protein, or what we call an antigen, basically a part of the virus that your immune system then creates an immune response to. So this is mRNA is something that our bodies have and produce all the time to make proteins, and these vaccines give our bodies the mRNA so that we can produce the virus proteins that then allow our immune systems to have a response. We're not injecting any virus. There's no live virus. It's really just the surface protein, the spike protein that is being produced from the virus. Both of these are 2-dose vaccines, and we'll talk a little bit more about that. And in both studies, as well as in real-world data, they have been shown to be very effective. In the phase 3 studies, they are both around 95% effective. And they do have some mild side effects. Dr. Wray will talk about this later, but the common side effects would include most commonly pain in the arm where you get the injection site. Headaches and malaise do happen in a fair proportion of people, sometimes chills. After the second dose, about 10% or so of people will get fevers, for instance. Very few more severe side effects. Anaphylaxis is something that happens, but the likelihood is around between 1 in 250,000 to 1 in 400,000, depending on the vaccine. So those have turned out very well, surprisingly well. I think everyone is very happy with how effective they are. The Janssen or Johnson & Johnson and AstraZeneca vaccines are what we call viral vector vaccines. So they work somewhat similarly, where there's actually a common virus. It's not a live virus. It's actually just a part of the virus. It's called adenovirus that causes the common cold. This is used as a way to get the code for the coronavirus protein into our cells. And then once again, our cells produce the protein of the virus, and then our immune system reacts to that and causes an immune response. And these 2 have been shown very effective. In the studies that they've done, which are a little bit different, they're between 66%. In one study for AstraZeneca was 60% effective overall. However, for severe illness, they're much more effective. And I'll just show that on the next slide here. This is a busy slide, but what I'll get you just to take away from this is that from the phase 3 studies, now I haven't updated the most recent study from the US for AstraZeneca as it's not been published, but the protection against hospitalization and against severe disease and death for all of these is very high. So real world data is probably not quite 100% effective, but very, very high at preventing more severe illness for all of the vaccines that are available. And I think in the end, this ends up being the most important thing, because that's really what we want to prevent. Protection against mild to moderate infection in some of the studies varies depending on where the vaccine trials have happened. So I did mention that there are potentially some variants that may not respond to the vaccine in the same way. And you can see that here in the studies of the Johnson & Johnson vaccine, for instance, in South Africa and in Latin America, they're less effective than it was in the US, for instance. The similar thing was seen with the AstraZeneca vaccine. I'm just not showing the data here. Okay, with that, we do have some data on real world effectiveness. So just how good are the vaccines at preventing infections now that they've rolled out? So in the US, there's data from the mRNA vaccines, and they show that they're about 89% effective against symptomatic infection. And they're showing that even if you do develop infection and you've received the vaccine, you're still protected at least partially from getting more severe illness. So even if you do still get infected, you get less sick, which is also important. And in the UK, similar data showing very highly effective mRNA vaccines, 86% against symptomatic infection. Israel, somewhat similarly. I didn't show the AstraZeneca data here. AstraZeneca vaccination data from the UK, for instance, has shown very similar results and showed at 3 months, even after a single dose, about 80% effectiveness. So overall, quite promising across all these vaccines. And Steve highlighted this, but I just wanted to show, what has happened locally with the rollout of the vaccine. So the long-term care facilities were able to receive vaccines beginning at the end of December, and then for the residents in January. And you can see here from data that's been published is that these are the number of weeks since vaccination happened at a long-term care facility. You wouldn't expect anything to happen until about 2 weeks after vaccination, because that's how long it takes to develop an immune response. But you can see a dramatic decrease in the number of cases in both residents in long-term care and healthcare workers in long-term care after vaccination. And we now have very few cases, and even the cases that we are seeing, they're often not resulting in significant outbreaks. So it is a testament that these vaccines are really saving a ton of lives. When we get enough rolled out, should have a significant impact on the rest of the population. So I'll leave it there with that, and I'm going to, I think, pass it back to Jonathan at this point.
Thank you very much. Our next guest is Dr. Rebecca Wray. Dr. Wray is a family physician at the Medical Associates of Port Perry and the Mississaugas of Scugog Island. She's also the lead physician for inpatient care at Lakeridge Health in Port Perry, the co-lead of Durham Region COVID Assessment Centers, as well as a primary care lead at the Durham Region Vaccine Steering Committee. Welcome, Dr. Wray.
Hello. Thank you for the introduction, and I'm excited to be here. I'm planning on going through some myths and some facts just to help set things straight with respect to the COVID-19 vaccines. And before I start, I just want to verify everyone can see my screen. Is that good? Perfect. So myth number one, we can't trust COVID vaccine because they were rushed. So this is a common thing that we hear. I hear this often in my practice from my patients. Early on in COVID too, I thought, oh, gee, these vaccines came out pretty quick. Do we need to be worried about them? Were they well studied? The fact is that even though the COVID-19 vaccines were developed in record time, absolutely true, it's not because there were shortcuts. In fact, the research process was far more rigorous than the average research process for any other vaccine that's ever been developed, because COVID is so prevalent and so prominent and affects people in all different age groups and all over the world. We were actually able to include many times more individuals in the randomized controlled trials for the vaccine efficacy and safety than we normally would when approving a vaccine. So to give you an example, with the Pfizer vaccine, there were over 40,000 people included in those randomized controlled trials for the Pfizer vaccine, where a typical vaccine trial would have 5,000 or 6,000 people included. And furthermore, I mean, these studies were done all over the world, all different age groups. And so these are very rigorous processes and not rushed at all. We were able to do them in a timely manner because COVID is a short-lived disease. So you get COVID and you get sick and then you get better and then it's transmitted. Two, the incubation period is 14 days or less. And so it's actually quite amenable to a study. The next myth, the vaccine will give me COVID-19. So, there of course is a worry that when we take a vaccine, is this safe? Are we going to get the infection from this? And the fact is that you cannot get COVID-19 from any of the vaccines that are currently approved by Health Canada. So the mRNA vaccines, as Dr. Riccuito reviewed, do not have any virus in them whatsoever. And so you can't get COVID from those. And the other vaccines use a viral vector that is not the COVID-19 virus. So they use a viral vector to deliver the vaccine, but you cannot get the infection from the vaccine. Myth number 3, we don't know what's in these vaccines. I don't want to inject this. I don't want to inject this into my body if I don't know what's in it. The fact is we absolutely know what is in these vaccines. So these are very safe vaccines. The ingredients list is published and available for the public if they are interested in knowing exactly what is in the vaccine. None of the vaccines have any mercury in them. None of the vaccines currently approved in Canada have any food product in them. Again, as we talked about, none of the vaccines currently approved in Canada have any virus particle in them. None of the vaccines have any formaldehyde or other preservative in them. These are very, very safe vaccines that are well studied, and we can see the ingredients list for them. The one thing to note, so the mRNA vaccines do have PEG in them. PEG, polyethylene glycol, is a product commonly used in many medications, and also in cosmetics and things like toothpaste, face cream, different things like that. So the vast majority of people in the developed world anyway have certainly been exposed to PEG in their lifetime, including Restorelax or Laxaday, the laxatives that we tend to use over the counter that you buy, the white powder, that is actually PEG Light 3350. So that is the primary ingredient other than the mRNA. And those mRNA vaccines, very, very safe. Myth number 4. The vaccine is not safe. So these vaccines are very safe. There's excellent short-term safety data on all 4 of the COVID-19 vaccines that have been currently approved for use in Canada. No serious side effects have been found to date. There is lots of media talk about the AstraZeneca vaccine and the risk of blood clot, specifically in relation to the AstraZeneca vaccine. And I believe we have a question on that. So I'm going to actually leave that to the Q&A for Dr. Riccuito to address. But these are very, very safe vaccines, including the AstraZeneca vaccine is a very safe vaccine. And true allergic reactions are incredibly rare with these vaccines. Myth number 5, I already had COVID-19 infection, so I don't need the vaccine. So the fact is that we still recommend that everybody be vaccinated, even if you have had COVID-19 infection. And the reason is that we don't know how long natural immunity will last. So we know that when you get COVID-19 infection, you will have natural immunity, and actually that natural immunity is quite high following infection, and at least for 3 months and probably for 6 months, but we don't know how long that natural immunity will last. And because it just hasn't been studied, we haven't done those specific studies as of yet. We're learning as we deliver these vaccines, and so the information is coming. But we do recommend that even if you have had COVID-19 infection, you get vaccinated. Probably you don't need to be vaccinated for 3 months post-infection, because natural immunity is actually probably quite high for the first 3 months post-infection. But after that, we would recommend that you consider vaccination. And if you have had COVID-19 infection, then what you will do is you'll talk to your doctor before you get vaccinated to find out when the ideal time for vaccination is in your specific case. So I've had the vaccine. What can I expect? So 85% of people will have a sore arm. You absolutely will feel like you had a good punch to the arm in the 24 to 48 hours after you've had your vaccine. Many people will feel fatigued, feel tired, have a headache, and you might feel achy as if you're coming down with the flu or with a flu. Those side effects typically will last for anywhere between 24 to 72 hours, and then they should resolve. Some people will get some joint pain, and about 15% of people might develop a low-grade fever or some swollen lymph nodes. Typically, all of those side effects will resolve, as I said, within 72 hours. And when you get your second dose of the vaccine, the side effects are more robust, okay, because your immune system is just a bit stronger. Do I still need to wear a mask after I've had the vaccine? The answer is absolutely. So our public health guidelines will dictate how we protect and prevent transmission from COVID-19. Vaccination is one part of that puzzle, is one piece of the puzzle at reducing our chances of developing COVID-19 infection and reducing our chances of transmitting COVID-19 infection. But we will still mask, we'll still physically distance, we'll still wash our hands and stay home if we're sick. Okay. What about pregnancy? This is a really common question. So the thing with pregnancy is that pregnant women were not included in the randomized control trials in the vaccine studies. Okay. And so initially, it was unclear whether or not we would recommend vaccination for pregnant women. And what we recommend now is that all pregnant women consider vaccination and that they talk to their primary care provider about vaccination. What we do know is that pregnant women are at much higher risk of severe infection and even death if they get infected with COVID-19. And so, we know that the vaccine prevents almost 100% of the severe cases. So on that one slide that Dr. Riccuito showed, we saw almost 100% protection against hospitalization with all 4 of the vaccines. And so we do encourage all pregnant women to consider vaccination because the benefits of vaccination almost always will outweigh any potential risks associated with vaccination. Okay. What precautions do we need to take? So if somebody has a bleeding problem or they bruise easily or they're on aspirin or a blood thinner, we're going to ask them about that. People who've had a history of fainting are going to let us know so they can wait a little bit longer. Again, pregnant and breastfeeding women are going to talk to their family doctor. And we do encourage people who have issue with their immune system, who are more at risk of more severe infection, or who are on medication that suppress their immune system to talk to their primary care provider prior to vaccination. Okay. Who can't have the vaccine. So there's actually a very, very short list of individuals who are unable to be vaccinated. And that includes anybody who has a known anaphylactic reaction to the vaccine in the past. So if you have anaphylaxis requiring an emergency room visit or hospitalization after your first vaccine, it's about 1 in a million, you're not going to get your second dose of vaccine. Okay. If you have anaphylaxis to anything in the vaccine. So if you know that you're anaphylactic to PEG, for example, you won't be a candidate for the vaccine. If you've had another vaccine within the last 14 days, we ask that you not get vaccinated until after that 14-day period. Okay. It's not that there's any interaction between the vaccines. It's just that we don't want, if you're having a side effect from one vaccine and then you get another vaccine, it's a bit confusing as we're studying these vaccines. And also, if your immune system is busy creating antibody for one vaccine, it might not create enough antibody for the second vaccine. So you just wait 14 days after you've had one vaccine to get another. And if you're acutely ill, you're not going to get the vaccine. or if you're outside the age group. So the vaccines that are currently on the market are only for adults. So Pfizer is approved for age 16 and up. Moderna is approved for age 18 and up. The Pfizer vaccine does have ability to give the vaccine to individuals who are at high risk between 12 and 16. But again, that would be in discussion with their family physician, and that would be for specific circumstances. When will it be my turn? So it might be your turn already. And Steve has already touched on this. So in Durham region, we are currently offering the vaccine to anyone age 75 and over, as well as those who are receiving chronic home care. And obviously our retirement homes, our long-term cares, our congregate care settings we're starting to vaccinate our alternate congregate care settings, and of course our Indigenous population. Okay, and DurhamVaccineBooking.ca is your best location to track down the most up-to-date information. In the meantime, we're going to stay home, wear a mask, keep our distance, wash our hands, and get vaccinated. And that brings me to the end. So I think we're at question time.
We do have a number of questions. Thank you very much for your in-depth analysis of what's going on. It certainly is very informative. I think what we'll do is we'll ask Stephen Gray to come on first, and I'll address the questions to Stephen. All right, Stephen. So the first question that I have is the status of the vaccine availability is always changing, sometimes minute by minute. So the most up-to-date source of vaccine availability, where would people find that?
Yeah, good question. And you're right, it is changing rapidly. Durham.ca, the website that I had pointed out earlier in the presentation, is a great resource. A lot of information there. You know, the important thing, of course, is to find a trusted source. So I would highly recommend that, you go to the Durham.ca website. There's a vaccine button there, and there's a number of questions that are answered in that and on that website.
There seem to be two portals, the Durham Region 1 and an Ontario one. So if you go to the Ontario one, are you automatically transferred to the Durham Region 1, or are they totally separate? You
will be transferred to the Durham Region 1. Durham set up a booking site in anticipation of perhaps a delay on the provincial side. We wanted to make sure we were ready. And so we did deploy that. So I would imagine that at some point we'll transition, but that should be seamless for people. If you go to the Ontario site, you'll be redirected to Durham.
Okay. The last question I have is, when they get the vaccine site in Port Perry up and running, will couples be able to register at the same time?
I think that's something that is being worked on through the booking system. So hopefully, because I've heard that before, that can be a source of frustration. So my understanding is that is being worked on.
Okay. And the opening of the Port Perry one, the date is?
March 31st.
March 31st. Okay. Thank you very much. I'm going to ask Dr. Riccuito to join us for some questions. And there we go. Dr. Riccuito, the first question I have here is people would like to know more about the side effects of vaccinations. Now, you covered a lot of that, but the specific here is if people are trying to start a family or they're thinking about having children, is there an issue with the vaccines?
Yeah, so there have been no links to any problems with fertility. We've had a number of questions about this pre-pregnancy and even during pregnancy, as Dr. Wray had spoken about. So the vaccines are safe. In fact, being vaccinated prior to pregnancy is probably the best bet in that during pregnancy, the antibodies that develop from vaccination are actually transferred as well, just like any antibodies that the mother has to the fetus and to the baby. So when the baby is born, there will also be some protection there. So the timing's often the best then, and it is safe. And the guideline bodies or the associations, for instance, the fertility and OBGYN associations have also advocated for vaccination for people undergoing fertility treatments or looking to have a baby. Everyone in the seniors' residences has been vaccinated. The concern is that in West Shore Village, even though everyone was vaccinated, one of the staff tested positive. So they're under lockdown again. So the question is the vaccine actually going to put an end to lockdowns, or is it just going to sort of
diminish issues?
Great. Okay, I can talk about that as part of my role for infection prevention and controls, working with the long-term care facilities and retirement facilities as well. And so I have some knowledge. So I guess a few things to take away from it. I did show a slide earlier on that shows a dramatic decrease in the number of cases that have occurred in long-term care facilities and retirement facilities. And that it has made a huge difference. And the number of outbreaks is also down significantly. I think will continue to go down as more staff members get vaccinated. The vaccines are not 100% effective, so they won't prevent every single infection. They if they're 90% effective, then 10 out of 100 exposures may still result in infection. What I did comment on before, though, is that cases are still less likely to be severe if you've been vaccinated and you get infection. The other thing that I didn't talk about, which I think is important, is that there have been a couple of studies now showing that even if you get infected, the likelihood of transmitting to others is lower because you're actually not shedding as much virus. So I think that is another piece that, if you are vaccinated and you get infected, you're less likely to actually give it to someone else. Now, the question about lockdowns, for instance, or outbreaks in long-term care facilities or retirement facilities, as of now, part of the issue with the outbreaks and lockdowns is the definition that the ministry is using, whereby any single case of COVID is considered an outbreak. I think that going forward, as more and more people get vaccinated, and probably after this next wave, there'll probably be changes to the way we define outbreaks so that they maybe would be only be called if there's actually transmission within a facility. So I think that probably will change in the future.
So what vaccines will be offered to people over 75? Someone has atrial fibrillation and they're concerned about taking the AstraZeneca vaccine. Someone else is concerned about Crohn's disease. What sort of concerns should these people have?
Yeah, so right now, anyone 75 and older or born, I think, in 45, my math is maybe wrong there, 46, are actually eligible for vaccination now. And the vaccines that we have here in Durham are both Pfizer and Moderna. So if you're over that age group, that's available. We'll, as per the framework and the phases of vaccination, they're going to start going down in 5-year intervals. So fairly soon, I suspect, vaccinations will be opened up to 70-year-olds. And those would be the ones at the clinics where the mRNA vaccines are available, the Pfizer and Moderna. As of now, at some of the pharmacies, though not here in Durham as of yet, and some primary care offices, again, not in Durham, there's pilots ongoing with the AstraZeneca vaccine. I would suggest that, obtain the vaccine that's available to you first. That's usually the best advice, especially as cases are starting to go up. It is likely, though, that if you're 75, you'll have access now to the mRNA vaccines. And if you're 70, you'll probably have access to the mRNA vaccines pretty soon. So the second part of that question, I think, was about Crohn's. So there's two things. People that have autoimmune diseases like Crohn's disease, or if they're on medications that suppress the immune system, they should have a discussion with their healthcare provider before getting vaccinated. But for the most part, there's no significant increase in risk in patients with Crohn's and on medications that suppress the immune system. Depending on which medication you're on to suppress your immune system, the vaccine may not work as well. There was a recent study published showing that one of the types of injectable medications showed the vaccine doesn't work quite as well as if you were on a different type of medication, for instance. So that's something to sort out. So that is just, I think, something that you want to bring forward to your healthcare provider to talk about the risks and benefits. Certainly people with immune compromise or the immune system's weaker or have autoimmune conditions may be at higher risk of more severe illness from COVID. And so vaccination is usually recommended in those situations regardless.
And the last question I have is, everybody wants to travel. Everybody's dying to get out on an airplane and go somewhere. So the question is, if you're elderly, if you're over 70 or 75, and you are thinking of traveling, is there a preference in vaccines?
I would suggest so. The one thing, kind of in the back of my mind is, depending on where you're traveling, when you can travel, there might be a higher risk of exposure to these variant strains that I talked about. And given the data that we have now, there's just the AstraZeneca vaccine does not seem to work as well against some of these variants. For whatever is circulating in Ontario currently, the AstraZeneca vaccine works very well, for instance, as well as the J&J. But depending on where people are going, that might be a consideration to have in the back of their minds. I would say, though, that waiting for a long period of time for one vaccine versus another is probably not a good idea, as cases are starting to go up again in Ontario, and we want to protect ourselves while we're here. But that's one consideration.
Right. Thank you very much. Very much appreciate the answers, the candidness, and the insight, which has been very, very helpful. Our next guest that we're going to bring back is Dr. Wray. So I have several questions. Your myth busting was interesting. I thought that was really good, because there's a lot of information that I have heard, and I'm sure many people have heard, that is totally out the window. So the first one I have here is, and I'm assuming that the vaccine supply is regulated federally and provincially, that there's nothing that Durham itself can do about that.
That's right. Durham has a fabulous group. Our public health team is at the provincial table, meeting with all the people that you need to meet with, and speaking, using our voices very loudly, saying we need more vaccine. And it's just the way that it's being allocated provincially, right? Our province is big, and we have a lot of people in the province, and we definitely have a lot of needy areas. And vaccine distribution, I think, is a good point. So vaccine distribution, while equitable in terms of population, is also being distributed preferentially to areas of higher need, and areas that have been very hardly hit by COVID and are currently experiencing very high rates of COVID are definitely being prioritized for vaccine. And I think that's very appropriate, much like we prioritized vaccine for our long-term cares first.
Now, the Johnson & Johnson one-dose vaccines, are they scheduled to come this way in the near future, the far future? Is there any discussions on that?
Yeah, so I don't know dates. Certainly it's been approved, and I heard there were production issues. I'm not sure if Steve Gray or Dr. Riccuito might be able to answer that better, but it's not on the very near horizon to be in Durham region. It's not on the next, I would say it's not in the next 4 to 6 weeks in Durham region, although I have to say things can change on a moment-to-moment basis with everything COVID.
There was some concern a few weeks ago when they said that it's the honor system as far as requiring a vaccine. If you feel that you need one because you have a certain illness, you don't have to prove anything. You can just tell them that you're in a situation and you'll get it. The concern that some of the people who sent in questions are, how are they going to monitor so people who truly need them actually get them?
That's a great question. And it's a very, very difficult thing to navigate, because there are many illnesses that put us at higher risk. And there's also caregivers of people with those illnesses. So primary caregivers, or essential caregivers, as we're calling them, who need to be protected as well. And we are relying primarily on the honor system. We'll be using, I imagine that our public health team and our vaccine teams, as we roll out vaccines, will actually be relying a lot on our primary care providers to help to identify patients who are at higher risk and are due for vaccine, but we also rely on our citizens to be truthful and honest and respectful of each other.
So what happened when after when they were first announced? It was 29 days. You have to have your second one, but now it's okay to go 4 months. Obviously, that's a little unsettling in people's minds, because people are skeptical of anything that changes.
So now our Vaccine Advisory Council is the National Advisory Council on Immunization in Canada, or NACI. And NACI actually has reviewed the literature. They've reviewed real world experiences with the vaccines and with COVID and with how the vaccines have been administered worldwide. And the evidence is there that even with one dose of vaccine, there is really good coverage against severe COVID and hospitalization. I can't give you the precise numbers because it is a little bit different for each vaccine, but there is very good coverage for severe COVID. And so if we can reduce the COVID that you get from really bad COVID requiring hospitalization or resulting in death to a cold, and we can reduce the number of deaths overall, that is the approach that NACI has taken.
Right.
Dr. Riccuito actually has had a great slide that we presented last week for a different group on using a one dose approach. So taking all of your doses and giving more people their first dose, and then delaying the second dose, and later, 4 months later, giving everybody their second dose, it reduces the illness from COVID, it reduces hospitalization, and it reduces deaths dramatically. It's very incredible to see, and it's very convincing to see. And I think when people would see that data and think, well, that's great if my brother who's only 55 can get a vaccine and then not get severe COVID, or, all the people with comorbidities, there are a lot of them out there. The more people we can get one dose in, the better it's going to be for all of us.
And is it safe to assume that the second dose that you get has to be the same vaccine as the first?
Currently, correct.
All right. And do you think this is something that's going to be an annual thing, like the flu shot?
Probably.
Yeah.
We don't know that yet, but probably. Dr. Riccuito is the ID specialist. I think he would say the same thing, probably.
I have lots of room in my arm. That's not a problem. Someone here was saying that their mother, who's 65 in Montreal, got her vaccine at Costco. And why is Durham so far behind in that sort of process?
Yeah, so that's a great question. And it's important that we ask these questions too, right? Because that's how we will make progress. So what happened in the province of Ontario is that the AstraZeneca vaccine, which is the only other vaccine other than Moderna and Pfizer that we currently have, and that is the vaccine that is amenable to giving in the pharmacies. So I'm sure that this individual received AstraZeneca at the Costco. The way that our province has done it is they've developed a pilot program for pharmacies and for primary care offices. So there are 6 regions currently in Ontario that are involved in that pilot program for administering the AstraZeneca vaccine, and that will be rolled out. So stay tuned. Durham region is in the very near future of embarking on that pilot program.
Excellent. Thank you so much. Thank you very much for answering all the questions. Thanks to all of you. It's certainly a great deal of information that we've had today. I want to thank all of our guests, and I want to thank everyone out there for sending in the questions as well. I think we all very much appreciate the information, the informative responses, as well as the candidness of your answers. Once again, let me make special mention of the sponsors of today's event: Mike Adam of Gus Brown's Pontiac Buick GMC Limited, PP Print and Digital Services, Scugog Computers, and Voss, your independent grocer. So to give you a short update on what's in store for the Chamber of Commerce, I'd like to ask Terry Voss to turn his video on.
So thank you, Jonathan. It was awesome. So during COVID, the Scugog Chamber has been working hard on having some safe events for 2021. And right now we have a couple things that are lined up. We're looking at having 2 golf tournaments this year, our Craft Beer Fest, and always our most popular Santa Claus Parade. Just keep an eye out. There's more information to follow. And I'd like to thank everybody for participating today. It was awesome. Thank you.
Thanks very much. That's it for today. Thank you all for your questions. Again, thanks to our guests for their insight. As I mentioned, this program will be available on Rogers TV and the Scugog Chamber's website and YouTube channel starting April 15th. I'm Jonathan Van Bilsen. Please join us next month when our guest will be Durham Region MPP Lindsay Park. Thank you very much for joining us, and stay safe.